So there was an interesting abstract coming out of the FDA looking at the impact of antibiotic use on immune checkpoint inhibitor efficacy. The underlying hypothesis here is the concern that antibiotics could alter the microbiome in a negative way. And there's been a lot of discussion of that over the last few years. So what the FDA looked at was they looked at survival and PFS in patients treated with immune checkpoint inhibitors, either with or without antibiotics, and then the same thing for patients treated with chemo with or without cetuximab, again, treated with or without antibiotics. And what was really interesting here is that there was a big survival difference in those who were treated with immune checkpoint inhibitory therapy at 6.7 versus 12.3 months, but no such effect in chemotherapy-treated patients. There was 8.6 and 8.8 months. The question is, well, were they just sicker patients? Again, the fact that the effect was uniquely in the immunotherapy arm speaks to that. That's probably not the case, but also there was at least numerically a difference in PFS as well, 2.1 versus 3.5 months for immunotherapy, whereas it was 3.6 versus 4.5 for control patients. So is this practice changing? Well, maybe. In my practice, if a patient has a clear active infection and they're on immunotherapy, I'm going to treat them, because if you don't treat an infection, your patient dies of infection with lots of suffering in between. However, if we're going to all be honest here, a lot of antibiotic use is borderline or inappropriate in practice because a patient demands it or because we're just being careful, right? And we think, well, the risk benefit here, if I don't give it and there's an infection, my patient suffers a lot and potentially dies. But if I give it inappropriately, maybe they'll have a little diarrhea. There's a small C. diff risk. There's a societal risk of resistant bugs, but that's okay, right? I think this changes the risk-benefit consideration for that individual patient, such that in borderline cases or really inappropriate cases, in a patient on immunotherapy, we need to be much stricter.